Hello, beautiful people, and welcome to BipolarLines, your lifeline for honest, unfiltered conversations about loving someone with bipolar disorder. I'm Brooke.
And I'm Laura, and together we're sharing our experiences with you. Each week we dive into the messy, beautiful truth and some practical skills that honestly have helped us so we can help you.
Yes, absolutely. So, of course, to our OG listeners and to all of our new listeners, if our show speaks to you, please do us a solid. Go and like, subscribe, follow, whatever that option is on the platform that you listen to. You could also join our Facebook group, Bipolar Lines Pod. It's a private group. It's a safe space for us to just talk, post anonymously, ask for advice, or get support.
Yeah.
All right. So today's topic is going to be on how to find a therapist that works for you. But before we dive into that one, let's just do a little life check-in. How's it going, Laura?
Yeah, good. I don't know if in my last one, what had happened, but I still feel like I'm still on a high coming back from our 20th anniversary trip. I don't know if I've talked about that, have I?
Yeah. It was a couple episodes ago, but we had, an issue with episodes. So that was the last one, wasn't it? I don't even remember. I don't know.
Yeah, I don't know either. But anyways, I'm still kind of on a high from that. And it was interesting because there was a lot of overstimulation that vacation, which made it a little nerve-wracking. I mean, we're going through Vegas, we're on a cruise ship, there's casinos, there's all the things. There's all the things. Yep. And then, not great scheduling, probably not the best sleep schedule.
Right.
But you know what? Like, he has been fine, and we've been back now for over a week, and he's still fine. And so
I love that.
Yeah, I'm very thankful for that. Yeah. How about you?
That is awesome. Things have been pretty low-key here. I know Jeremy was super nervous about how our episode would do with him because that's how he is. He wants to make sure he didn't mess anything up, which is so sweet of him. But yeah, other than that, we're just cruising. It's hot as I don't know what in Tennessee. So
oh no.
If you hear a little more background noise this episode, it's because there's a fan blowing. My thermostat, I had to bump it up. It's set to 74 because it will not cool past 74. And it's just
no.
Hot. It's like in the 90s,
that is hot.
96. It's hot. And in Tennessee right now, there's hardly any wind. So it's just like standing heat. And it's just awful.
Is it humid in Tennessee?
Yes, it is definitely humid.
Okay, because it's like, what is it right here? Well, I guess it's in the 80s here, but even when it gets to the 90s, without the humidity, it's not so bad, I mean, it's hot, obviously, but I feel like humidity on top of heat like that is like, or at least coming from, someone in Denver, our air is really, really dry. It's a complaint here from some people, but yeah, when I hit humidity, I'm like, oh my God, how do people do this?
Yeah, it's just instant sweat. Just instant sweat. There's nothing you can do about it. You walk outside and it takes your breath away and you immediately start sweating. And it's like, I can't. I don't want to do this. So, totally. Dealing with the heat. Nobody wants to take the dogs out, because it's hot. Yes. But here we are. So nothing new, which is
good.
Which is good. Yeah.
I know. I feel like that doesn't happen to either one of us a lot. One of us usually has something going on.
We are bouncing off each other like, okay. But that's good. I will take the win for sure.
Yeah, me too.
Yes.
All right. So finding a therapist, I think that it's so interesting. On my TikTok, I've been talking about, occasionally just kind of glimmers of what we're talking about on the podcast. And one of them being education. And of course, a lot of education can start with finding a good therapist. A lot of education can happen with not finding a good therapist.
So true.
And so I know, right? And like some people, there was one person that was like, it still doesn't help the pain, hurt, and confusion. And I'm like, But I have to push back on that because I think that it would. Like, if you honestly understood how to separate your person from the illness, if you honestly understood characteristics of the illness, and if you honestly, I get questions all the time like, how could he say that to me? How could he ask for divorce? I'm
Yeah.
so hurt. I'm so confused. And their feelings are valid. And have I been there?
Yeah,
Yes.
for sure.
but
For
but
sure.
that how question can be answered with education. That you're right.
Hmm.
Does it still sting? Of course. Like, I'm still a human. I still feel those emotions, but not as strongly as if I'm just like so confused, like it came out of left field. And where did my loving husband go? And I don't get it. Like, it really does help if you educate yourself. And so therapy is a really important aspect, in my opinion, of it as well. And also, I never had prior experience with therapy. My sister is older than me, and she had seen a therapist after she moved out. But otherwise, my family was by and large very much kind of against it.
Sure.
I hate to
Sure.
say
No, I
that,
get it.
but yeah, they
I mean,
just didn't.
I'm sure that is actually a lot of listeners' experience. A
Okay.
lot of
Yeah.
listeners in our age demographic, they're likely going to experience a very similar situation. So I think that's good
Yeah.
to know.
Yeah, so I really had no background to it, and I really didn't even think to go to one. Like, that definitely was not the first thing that popped into my head. And so I don't even know now. It's been so many years. I think it was the discussion group. I talk about this discussion group I was part of in the
Yeah.
early days, and it was them who was really like,
Gotcha.
you should get a therapist. And I'm like, a
Hmm.
therapist for what? He's the one with the problem.
Yes, because the association is somebody has a problem, somebody needs a therapist, right? But I want
Hmm.
to just make that so clear for everybody. Like, you don't have to have a problem to have a
Right.
therapist.
Right.
Even if you have friends of friends of friends who don't live the life that we live, like, everybody needs a therapist. Just imagine a safe space to bounce off anything and everything with, that's a neutral party, that's not going to have opinions and judge you. Everybody needs a therapist, period. Okay. I'll
Yeah.
step off that soapbox. Continue.
Well, actually, I'll piggyback on it where in hindsight, when I look back, your brain is one of the most complicated organs that we have. And we have a doctor for all the other systems and organs in our body. And we
Yep.
just decided collectively that we don't need one, even for maintenance for our brain. It makes absolutely no sense when you look at it that way. Really.
Totally, totally agree. Totally
Yeah.
agree. Yes. So yeah, getting a therapist, an educated one for sure, can absolutely be a game changer for you. Um, and I think along that lines, now that you set the stage and foundation of it, is the bigger conversation for our group of people, our people that are walking in similar shoes as us, how to find a therapist that works for you. And I truly mean that works for you. Not just one that's a good fit, but one that actually helps you grow, meet goals, things of that nature, that has knowledge and understanding. So, where do we start? And I think you have to start by interviewing the therapists, okay? And just for the good of the group, this is not uncommon, okay? Therapists get calls, they have, or sometimes it's emails, with these preliminary questions from potential clients about how they want their therapy to go, what that looks like. So, of course, they're going to ask questions to understand like that person's perspective and that person's methodology, so on and so forth. So, Laura, I think we should just maybe give our top 3, 4, whatever questions, of what we would ask a potential therapist. And this, for the record, I think this applies to both individual and couples counseling. But again, I'm going to put that caveat out there. If you know me, you've heard me say this. Couples counseling does not work unless your person has gone through therapy, is stable, right? But has gone through therapy and is more self-aware. And I think that's been my experience, but that's also been what I've observed as others' experience that I've spoken to within this community.
Yeah, I agree because a lot of times if they're not kind of we're all kind of dealing with personal issues regardless of whether it's the person with bipolar or not, but like they can't deal with those issues in a couples counseling situation. Like whatever, they're like
Yep.
those that needs to be dealt with separately. I will say that sometimes couples counseling is the only way to kind of get their foot through the door. So if you're in that position where like, well, he just absolutely won't go unless it's couples counseling, then I would say, okay, like what's your purpose though then in getting the therapist? Is the purpose then get him his foot in the door, get their foot in the door, and then possibly use that as a launching pad to be like, yeah, it would really be beneficial for you to also have your own or something like that. You know what I mean?
Yeah. Yep. Yep. And I think that's a good point, because there's also situations where the diagnosed has gone to therapy and they've experienced a not so great therapist, and that therapist has maybe even told the diagnosed individual that, like, nope, you're good, um, see you later, you're fantastic, you don't need therapy. All that does is validates the diagnosed narrative that, like, there's nothing wrong,
Mm-hmm.
they don't need
In
to do any work.
in Cody's case, that wasn't what happened, but in his case, he just always felt like this was in early on, of course, but he just always felt like all of them were really condescending, and he felt like he didn't like how they were just he felt like he just felt very judged. So I don't know if that was kind of like him also having to deal with the initial diagnosis, like it was
Could have
maybe
been.
him projecting, or whether it
Yeah.
really was the case. I don't know, but he
Yeah.
rotates therapists now, unfortunately. I hate this system, but the way it is right here, the place that he can get into, they're residents supervised by the main guy, and then they rotate every 6 months. And I mean, that's never even come up anymore. So I don't know.
mm, that can be a lot to have to rehash the story in the background,
Yeah.
but yeah. Okay, so questions that you're going to ask these potential therapists, because the goal is to find one that will work for you, and you can't necessarily do that, I don't think, unless you have a goal in mind for yourself. So
Mm-hmm.
if this is individual, so like my goal for therapy would be to maybe work on those things that I'm not so great at. So whether that's emotional regulation, whether that's personal growth and advancement, like confidence, building confidence in myself, or you name it, right? So whatever my goal is, my questions need to be geared towards my goal. I think the only difference in our situation is, obviously, my relationship, my marriage plays a large part in my therapy conversations. And I've mentioned this before, I'll mention it again. Like, I had to set a very firm boundary with my therapist that was this: no matter what situation comes up, no matter, unless I'm at risk and I'm being abused, we are not bringing me leaving my marriage. It is not something you're going to bring up, because if you do, I will no longer trust you. My goal isn't to leave my marriage.
Mm-hmm.
My goal is to work on me, right?
Mm-hmm.
And she reminds me of that every so often. Not a lot, I shouldn't say that way, but like, I think she's reminded me of it twice in the last 4 years now. That works for me. So I can go into therapy and talk about marital problems, and I don't have to worry about her also saying something like, Brooke, how long are you going to deal with this?
Right.
It's not going to come out of her mouth. She
Yeah.
agreed to it. She knows that that is a firm boundary. But
Yeah.
aside from that, I also know that I wanted accountability. So one question that I know that I asked my now therapist was like, what is your approach to therapy? And how have you worked with other clients or patients in the past to hold them accountable towards their goals? That's a very specific question. And I think the answer is really important. If you are not goal oriented, or you're not looking for accountability, then fine. But if you are, then you need to know how they do it. If, like, blunt conversations, like at the beginning of the sessions, I usually bring up like where we left off or what goals we're looking at. Great. I have ADHD. I will absolutely get us off topic, and we'll be like, well, the session's over and we never talked about goals, right? So that's what I'm talking about. Like, how and what is your methodology? What's your approach? to making sure that I'm meeting the things that I set forth for myself.
Mm-hmm. Yeah, I love that one. The goals is huge, and my goals change throughout the years. Like one of my first initial goals was just to learn boundaries. I just was so confused about like
Yeah.
everyone in the discussion boards kept telling me to do them, and I'm like, I don't know what this means. And so it was to learn that, and in doing that, I learned a lot about the disorder, which in turn helped me understand things a lot more. So, but that was my initial goal set going in there.
Yeah, I love that. So a question could be like, do you offer guidance around setting boundaries or managing crisis? Like, do you have experience in those things, knowing that like we are spouses of people that have bipolar disorder type 1 or 2, whatever your situation is, right? But like, so it can't be this far-fetched, unrealistic, just take them to the hospital approach. Like we have to get down to, and dirty in the business of talking like step by step by step. Like, can you help me
Mm-hmm.
through those things? Right.
Yes, exactly.
Got it.
Yeah, I think another thing, a question to ask is, like in our last one when we had couples counseling, I don't think this is a make or break it for individual for you, but if you are going to go into couples counseling, and I had to do that with my husband 2.5 years ago, I absolutely needed to make sure whatever therapist we had understood bipolar disorder.
Oh, 1000%.
Yeah,
That
and
should have been our first. That should have been our first question. I apologize. That was my first question, but go ahead, Laura.
well, honestly, I don't think it needs it might be a deal breaker depending on what your personal goals are in therapy. So like if I want my own therapist, but it's not related to bipolar, it's like you said, it's related to like goals, or it's related to confidence, or it's related to organization, or it's related to like if it's related to that, I don't think your individual therapist not knowing a lot about bipolar needs to be a deal breaker, but it probably would be really important for you to ask because it's going to come up. If you're
Oh,
with
it's going to
someone
come up.
if you're with someone who has bipolar disorder, you might have gone in with goals around organization and achievements or whatever, and then they go into an episode, that's your therapist. So
Yep.
it's just, and you know what, you'd be surprised. I mean, I was surprised how many people don't honestly understand bipolar disorder. They don't.
1000% agree.
Not every therapist has the same experience, even experience. Like maybe they have the knowledge, but not the experience. And then depending on whether it's bipolar 1 versus bipolar 2, I mean, bipolar 2s are can be so much more self-aware. Like
Mm-hmm.
people I know with bipolar 2 and the people in my comments are like, well, I'm aware when I'm manic. Yeah, well, he's not. Like, that's great, and I'm happy for you.
Yep.
But so even knowing the nuances, and it depends on how much you need that therapist to know. So, but
Yes.
definitely having a background in it is so important.
Yeah, because I think without that background, imagine just relaying, recounting an experience that you had with your partner where you were hurt. And that therapist is like, why is this how they typically act? Like, oh, I didn't realize that was, it just takes away that like element of understanding if they
Yes.
don't know and have experience with it. And then, of course, you're going to feel judged for staying. So, like, for me, it is an absolute deal breaker for a therapist if they, even my individual therapist, if they don't have knowledge and understanding and experience of working with somebody who's married to or has worked with somebody who has a bipolar 1 diagnosis. Not specifically one, but they've worked with somebody with said diagnosis and or the spouse. There's just so many aspects of it that like I don't want to have to go back and rehash, and I definitely don't want to spend my time educating said
Exactly.
therapist.
Yeah, that's a waste of money.
Yeah, no thank
Not while
you.
you're there.
Mm-mm,
Yeah.
mm-mm. But also I think that the other side of this, of having someone that is experienced, is relative to this situation right here. We are telling our listeners to educate, educate, educate so that you can separate, separate, separate. A therapist who has the experience is also going to provide you with that same sort of roadmap, but they're also going to tell you when, oh, hold on, let's pause there. You're saying that this must have been the illness, right? Can you tell me what signs and symptoms were happening that verify, that give you the calling card that, yeah, your person's in an illness, because I'm not seeing them.
Hmm.
Because once you get into that mindset of separating a person from the illness, it is really easy to blame everything on the illness.
Yes,
it's
true.
real easy to do.
Yeah, we don't need to be making excuses for just plain bad behavior.
No, not at all.
Yes. It takes me back. I think one of the very first therapists I got, I ended up just leaving her because she wasn't helpful and I wasn't learning boundaries anyways, which was my whole goal in going in. I
Yeah.
even remember what she looks like. It was like, oh my gosh, I don't have to describe her, but I just remember like she was so stuck on narcissism. And she was like, this doesn't improve, this doesn't get better. And I'm like, so like I think she was equating his manic grandiosity with narcissistic personality disorder. And though there's overlap there, they are completely different disorders.
Yeah.
So that wasn't helpful. I'm like, this isn't helping me. Because that was the other thing. Even when he was diagnosed, he was initially misdiagnosed as schizophrenic. And I remember the psychiatrist at the hospital, she was like, everything must make so much sense now. I'm like, nothing makes sense now. No, I've known this person for 4.5 years. He's never acted schizophrenic. What are you talking about? It makes no sense at all. Yeah.
Right?
So,
Ugh.
anyways.
Yeah. And I'm going to go back and get on my DBT high horse here because I really think, I really believe that DBT can be a game changer because, again, even though we're talking to the loved ones here, you walk away from a DBT therapist with actual tools, actual skills, so that you're not left to just continue to make sense of the things that are happening with you from a mental health perspective, right? So, yes, we're going to talk about your feelings. We're going to analyze them. We're going to do all the things. We're going to vent. We're going to process them. But also, I'm going to leave you with these skills that you can use when you're triggered, when you're feeling XYZ, right? So I would honestly encourage anybody and everybody who can to find a certified DBT therapist, not just someone who has DBT experience. There's a very, very big difference there. Very big difference. But yeah.
Yeah, I know. And we have a whole episode if you guys are interested on DBT. It's earlier on in the podcast, but if you're interested in hearing Brooke talk about it, she gives you specific skills that she learned that are honestly very helpful.
Yes, it's episode 20.
Oh, perfect. Thank you.
Episode 20. Yeah. And then the other thing I think from an individual perspective is if somebody says, yeah, I have experience working with people that have a bipolar diagnosis. Okay, help me understand what that experience looks like. I mean, I don't need patient count. I don't need head counts, but like, what is your experience? Because I'm not looking for you to just check a box that says, yes, I have experience. I need to truly understand that you actually have experience. So how have you helped patients navigate or clients navigate, whatever term they want to use, when their partner has been in a manic episode and have filed for divorce? Like, have you had that come up? Or how have you managed prior crisis when their loved one was in an episode? They should be able to give you very specific relative examples, not hypotheticals.
Yeah.
And I think that is very, very, very specific, and you need to be mindful of that. Hypotheticals are hypotheticals. Because if I'm the therapist, I'm sitting there in that chair going, well, I would say, you'd probably need to da-da-da-da-da.
Yeah.
That means you likely don't have experience
right
with the patient and the situation. If you hear, well, in the past, I've referred to blah, 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 or I've done X. Okay, that's great. That's experience. That's tangible experience. That makes sense.
Yeah.
So don't just accept a box that's checked.
Exactly.
Ask the question and push for more. So yeah, I think that is a really important thing for individuals looking for a therapist, to make sure that the person actually has lived experience working with clients that have either a bipolar diagnosis or a spouse. What about you, Laura? Any other questions?
I mean, those are my main ones, honestly. Those are literally my top two. If you only,
yeah, two's
and
good.
I know people are reticent too to ask therapists questions. I get this even in my own field because I'm a speech therapist, and I tell people all the time, listen, I can't know every single disorder from pediatrics through geriatrics related to speech and language. I just can't.
Sure.
And so, any therapist should not be offended if you're asking them about, hey, what's your experience treating this? It's fine. No one should be offended here. So even in in my field, I encourage people to do it. But I would say even more so in mental health, it's common because people are commonly wanting to know, hey, I'm looking for EMDR, I'm looking for DBT, I'm looking for this, I do have experience with that. And I feel like it's really common. I mean, and people vet therapists on their website. They look for, I have a friend who's LGBTQ and he looks for LGBTQ friendly therapists. Like that is very important to him to have someone who has that background and they have it in their bio. So, I mean, it's not unusual for people to do this.
No.
Yes.
So do not be afraid. Do not be scared. And even if you send a question and they come back and say, no, I don't have experience with that. Okay, great. Move on. Like, you don't have to pick that therapist.
Yes, exactly.
Right? Like it's up to you. And, be mindful of after the first couple of sessions of like, okay, this is not, I'm not feeling comfortable. Even if you're bad with confrontation, just be like, I'm having a hard time. Like, I don't feel like we're connecting, or just be open and honest about that, because that therapist, let me rephrase that, a good therapist should recognize when they are not working for you, and they should be the ones to bring it up first.
Yeah.
For the record. So if you have to bring it up, there's likely a disconnect there, and that it might be time to look for somebody else.
Yeah.
Just there you go. I would also, this might be controversial, but I would also encourage people to maybe start with a therapist that is not within their comfort zone. So, for example, if their methodology and approach is to be blunt and direct, and you're used to not blunt and direct, or you think that that could be difficult for you, it may also be what you need. So don't be afraid to shy away from that comfort zone, because the goal of therapy is to get you to do X, Y, Z. Personal growth is huge, right? So if you are asking your therapist to provide you things that are still within that comfort zone, there's going to be less growth. So that might be counterproductive. That might not make a lot of sense. It might make you feel uncomfortable, but I promise you, if you try it, you might find it's actually more helpful than not.
Yeah. Yeah, totally. Be open. But then also if you're feeling, yeah, exactly, like it's not working, then that's
not working. It's not working.
Yeah.
And it's okay to be like, I really thought this was gonna work for me. It's not.
Yeah.
It is not. So, and they'll be like, no problem. I mean, I don't want to say get fired, but they get fired from
Right.
clients, patients all the time.
Yeah.
So, and they also fire clients and patients.
Yeah.
So
there's also like, there's supposed to be, I mean, therapists are truly supposed to be, what am I trying to say? Neutral, like neutral on different positions. But there are times where you might be able to tell that they're, you might know they're leaning and it's not how you lean, then that's too, I'm like, if I know that they probably, I know they're trying to be neutral, but if I can tell that they're just not feel like they don't feel the same way as me, I'm gonna let them go.
Yep. I mean, and that could be politically, that could be from a religious perspective, that could be all the boxes. Okay. Yeah, for sure. I think it can take a while to find the right one.
Me too.
Please don't get discouraged if you've gone through 2 or 3 and you're working on number 4. That's okay. My therapist, her name is Tamika. She's amazing. She is number 4 for me. But I will say, I started out with a life coach. 0 out of 10. Do not recommend. For our situation, don't recommend. She did a fantastic job of staying neutral. Because again, therapists are not here to diagnose your partners. That's not their job. They shouldn't do that at all. She did a really good job of trying to stay as neutral as possible without, telling me there's something very wrong with my husband. And this was prior to his diagnosis. So it was interesting, but all of her coaching, all of her advice was directed towards him. It wasn't about me. And it was like, you are so focused on him that like, I'm not getting anywhere. I didn't get a lot out of it. We'll put it that way. So I would look for definitely look for one that's a licensed clinical psychologist, licensed clinical social worker,
Yeah.
etc.
Yeah.
Yeah.
Now that COVID happened, there are these options to do online, like to do therapy online. And with my schedule, that's what I wanted this last time, both
Yep.
times. And so the marriage counselor we actually ended up finding, and he was in Arizona, but licensed in Colorado as well. And then my counselor is just on like the western slope of Colorado. We're over here on the Eastern Plains. But both of those options are what I want because it works for my schedule. The
Sure.
one I have on the western slope only does telehealth sessions, and that's not helpful for some people either. So
Yep.
just know that about yourself and your learning style. Like I said, my friend who also vets therapists, like he's like, it's just better for me to be in person. Yeah, and that's fine. Like, know yourself, know thyself.
Yeah. Know thyself. I'm also a virtual because she's not close to me. She's around here, but not close to me. And that works for me. I do it on Thursdays during my lunch break.
Yeah.
That's when it works for me. So, but if you believe that in person would be better, look for a person that does only in person or will do in person. Yeah, that's a great point, Laura.
What do you think about,
For sure.
I talked about a little bit before those stigmas that prevent people from getting a therapist. And I had many of those at the beginning, which was a family that really is by and large, not even not supportive, but very critical and judgmental of people who went to therapy. Therapy means that there's something wrong with you. This should just be handled at home. Oh gosh, I have so many because my whole family's full of them. Why would you tell strangers your problems? You should just tell people close to you. Oh my God, I had an uncle. We had an uncle that went, and it just made him worse and not better. It just goes on and on and on. So what would you tell the person that's fighting all of those internal stigmas, maybe internalized stigmas that they've heard through the years?
Sure. The only person that matters is you.
Amen.
The people around you that are influencing your decision making, that are trying to get under your skin and tell you it's not worth it, they are not living your life. Mm-hmm. They're not living your life. So I choose, this is how I go about it when I come across individuals like this, to combat their deterrence, their arguments with education. And in fact, usually it shuts them down. If they're like, why would you do that? Why would you tell your problems to somebody else? My response to that is, honestly, I think you would absolutely benefit from having a therapist.
I'm sorry.
You don't have to have a problem to go to therapy. Yeah. No, laugh. I mean, honestly, like, I'm a firm believer that like a lot of people will say the ignorant things because they're not educated about it. They are choosing to be willfully uneducated, and that's on them. It is not your problem to educate them or fix them or even, convince them that you are doing a good thing. If you need therapy, you want therapy, go to therapy. Yeah. And if they bring it up, they ask it, I literally use this line. Wow, that's a pretty sheltered perspective. I guarantee you would benefit from having a therapist.
Yeah, I love it.
Everybody would.
It's true. It's not even like, it's so true, people. I mean, and now I will tell you that now that my sister has been through, EMDR, and it made a noticeable difference just in observational, from her family. When I've been through it and it made an observational difference in how I handled manic episodes, now that my family has borne witness to that, I don't know about, maybe the men still aren't there, but definitely all the women now, including my mom. My therapist's name is Miranda. She will say, I really want to know what Miranda has to say about this.
And you're like, oh, do you?
Hey, mom's come full circle here. This is good.
Yep. So yeah, that's another great point to bring up there, Laura. That's how I would go about it. But I'm at the point in my life where I'm done sweeping things under the rug. Like, if you're going to come at me with stupidity, I'm going to come at you with education.
Yeah. Period. Yeah. And I think that's how both of us are. We're so open where a lot of people aren't. And if you're not there, you don't have to tell people you're going. That is confidential. No. You don't have to tell a soul you're going.
Nope.
So, I mean, Brooke and I are way past that, but obviously we're on a podcast shouting to the world that we go.
True. So true.
A little bit past that, but
little bit.
But
Yeah.
people are at different stages, and I do recognize that,
Yeah.
Yeah.
Yeah. So if they say maybe another way to combat it would be, you have a therapist? Why are you going to therapy? Like, because I want to work on personal growth.
Yeah.
I have goals that I want to
There you
achieve.
go.
Like, you don't have to give them all the details, just because there are things that I want to work on because I want to become a better version of myself. Right? Like, why does it matter? You don't have to give it, like Laura said, you don't have to give them all the details. You don't even have to tell them. But if they find out, my go-to is to come back with an educational perspective. It's not meant to be a jab, frankly.
I know.
But it is
It
a jab.
bites like one, but it's not meant to be one. Yeah, which is why I laughed. But I do understand it wasn't meant to be one, because truly everyone can benefit. So
yes.
And, we weren't, unless I guess, maybe you were in a family that, taught you all these skills, but we always talk about like breaking generational traumas. And that's how you do it, you guys, because you're not going to break any generational traumas by doing the same thing the previous generation did. It's not going to happen. I mean, maybe it's possible, but I mean, like, you have to do something different. I was just telling someone the other day, another thing that someone told me early on, there's a phrase. Lots of people equate like supporting someone with a spouse with bipolar disorder to supporting someone who has like an alcoholic family member, because it's similar. Like they said, even if you can't find a therapist, go to a what's it called? What's the support group for alcoholics? But it's like for the
AA.
Yeah, but it's for the family.
Oh, drawing a blank.
But you know what I mean, right?
Go to that.
Yeah, maybe
yes.
I can Google it while I'm talking.
I'm Googling
So
it.
anyways, there's a phrase in that support group that says nothing changes if nothing changes. And it did resonate with me so much. It's not a phrase that you use for bipolar, but it's because, it was like, well, I feel like I'm doing all the work. I'm the one going to therapy. I'm the one. Al-Anon. Thank you. Al-Anon has that phrase, nothing changes if nothing changes. And Al-Anon groups are also free. And so people said if finances are a barrier to treatment, a lot of people recommended I go to an Al-Anon group, because even though they're dealing with different things, it's eerily similar in the sense that an alcoholic is not your person. Someone who is under substance abuse disorder is not your person. And so you're doing very much the same thing. You're separating the person from their addiction, where we're separating our person from the illness. And that phrase really stuck with me. And so, because you do get resentful, I was resentful. It felt like all he was doing was the bare minimum. That's how it felt. I'm not saying that's what he was doing. I'm sure to him, he felt like he was climbing a mountain, just maintaining.
Sure.
But to me, that's how it felt at the time. And so I was getting resentful. Like, I'm the one in therapy. I'm the one reading the books. I'm the one doing the workbook activities in loving someone with bipolar disorder. Like, how is this going to be helpful? And they'd always bring me back to that phrase, because nothing changes if nothing changes. But if you change something, if something changes, then something changes. And that was enough for me. That was enough for me to be like, okay, that makes sense. Like, I'm still changing the equation, even if it doesn't seem like I'm directly affecting him. And it did work, you guys. It really did. It really did.
I love that. I love that. Also, I want to add this little golden nugget that you can keep in your pocket. When you want to start a conversation after you've, had some therapy sessions under your belt with your person. So you want to have a conversation about something that maybe hasn't always gone well in the past. You can pull out your little golden nugget and be like, so my therapist suggested that we talk about whatever.
Yes, I love that. And
your person is going to be like, your therapist? What? You talked to your therapist about that? Well, yeah, because I want to. It just provides like an elevated foundation with a neutral backing. Yep. And that's super important.
It's not as confrontational as you being like, hey, we need to talk. That dreaded, hey, we need to talk, that every man bristles. Like immediate, that causes immediate shutdown behavior. Yeah.
You get that golden nugget in your pocket, and it's I think it's pretty helpful.
Yeah. Yeah, me too. Or even if I wasn't saying like my therapist suggested, I might even say something like, you know what my therapist and I were talking about the other day? We were kind of saying blah, 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 blah. And like it puts it off, because unfortunately, at least for Cody, and I've talked about this in previous episodes, he hears everything as you hate me, I'm horrible, you hate me, I'm horrible, you hate me. That's what he hears regardless of what I'm saying when it's done, even when we were in marriage counseling,
Yep.
done in this
Yep.
confrontation. But if it was, oh, my therapist and I were talking about how when this happens, I react this way, but maybe this, and it doesn't cause that response. For some reason, he can like look at it as though he's like watching a story.
Yeah, because it's not a direct, it doesn't come directly from your mouth as your thoughts. It's like, this is, somebody else heard this too.
Mm-hmm.
I don't know. It's like a third person.
Yeah, for some reason, it's very helpful. Yeah.
Yeah. And also, let me pause and put a pin in that to also say, if the therapist talk, golden nugget, conversation starter doesn't work in this way, where that's not received well, it will be used against you. Like, oh, why don't you go call your therapist and tell your therapist what I did?
Definitely could happen.
Both are probably going to happen at some point, for sure. But
I just remember this. It's not funny at the time. My God, it was horrific. But I remember Cody being manic, and I'm experiencing hypervigilance and, complex PTSD because of previous manic episodes. And anxiety is terrible for his mania. It makes him more, my anxiety, I mean, it makes him more anxious. It makes him more paranoid. It like, and he's right. He's like, your anxiety isn't helping me. Like, it's not helping. Don't you understand? Like, I'm already blah, blah. And I'm like, well, don't you understand that your mania caused my anxiety? And so and he was like, well, didn't I tell you to get a therapist? And I'm like, I am in therapy. And he was like, well, it's not. It's just like, it's not funny, but it is in hindsight. But just like,
sure.
But so in that case, but he was manic, and anytime he's manic, everything will be weaponized against me. It's just kind of how it goes. Absolutely. And so therapy was one of those things. Well, tell her it's not working. She's not a miracle worker. She can't just make my body shut down. Like, I don't know what you want her to do.
My favorite response to that is, okay, hold on, let me go grab my pen and paper. What did you want me to ask her?
I love that, bro.
And I just wait. And he's like, you really gonna write it down? Yeah, I don't want to forget. Go ahead. What is it?
I'll have to do that. Hopefully this doesn't happen to me
give some pause.
Yeah, hopefully this doesn't happen to us for a very long time.
Right.
But in the future, I'll take note of that.
Yeah. So just know, and it's not, like Laura said, it's not funny, but when it does happen, you're gonna be like, are you seriously coming at me about having a therapist that I want to help me get better at being the best version of myself, so that I can learn to support you better, so that I can be more supportive towards myself, our kids? Like, is that the angle we're going with?
Yeah.
Again, come back to it from an education perspective. Don't try to defend it all, because defending does nothing when they're sick, for sure. But no, yeah, I think overall, you all, the listeners, have a good idea of the questions to ask, but also take that list, write those questions down, ask the questions, take them in with you. If you're an anxious person and you get to therapy and you're like, I totally lost what I was going to say, I'm nervous, like, write it down, keep it in your notes, pull it out, be like, I have my notes here because I'm terrible at remembering these things. Like, they understand, they see it all. So do the things. Don't not go to therapy because somebody else is telling you it's a terrible, horrible, no good, very bad idea, or that somebody else's experience with a therapist was terrible. Believe me, I've had some bad experiences with therapists, but it's not going to stop me, because I know I need that safe space. Mm-hmm. I know I do. I mean, and I can talk to Laura all day long, but I can also talk to this therapist who might tell me something different because she doesn't have our experience and our purview.
Yeah, and that's the thing. When we talk to our friends and our family, it has a purpose and value, and trust me, I do it too, obviously. But we also have to realize that friends and family have a different lens through which they're viewing your situation. So even when Brooke is telling me about something, my lens is bipolar 1 mania, and that might not be what's going on with her partner. And in fact, that has been a conversation before, but that's the lens I view things through. Yeah, Brooke has her own lens. Your mom, my parents have their own lens because they just don't want to see me hurt. And when Cody is manic, I get hurt. And so their lens is protect baby girl at all costs. Like, that's their lens. And so even if I can talk to them and find it helpful, it's not going to be the same objective reality you get from an objective party.
Yeah. Yeah. I think that's a great conversation, a great starting point for this whole find a therapist conversation. Find what works for you, right? If it's not, change it. And I don't know, just be open to going through the process, because I promise you, if you let it work for you, it will work for you.
Yeah. Yep, agreed. I like it.
Yeah,
It
awesome.
just kind of adds to our body of evidence saying educate yourself. This is also part of self-care, like that hour, even if your goal was self-care because you just can't fit it in, but you have an appointment to make and you just sit there decompressing. That why doesn't that have value? That might have value. Like, no, I scheduled a time for my self-care and I need this hour. So even for that, I mean, lots of different reasons to go to therapy, but like you said, it could benefit everyone.
Oh, for sure. Yeah. For sure. I think I can be a better wife, a better person, a better mom, because I have an outlet to discuss all the things with. And for the record, she's helped me with parenting things.
Yeah,
parenting decisions,
same.
parenting frustrations, all the things. Sibling conversations, I mean, just all the things. Okay.
All the things.
Where I'm like, oh, that's a really smart idea. I would never have thought about that. Like, that's the point.
Yeah.
A different neutral party to help you navigate your life in a direction that you want it to go. Okay, that's it. That's it.
There was this point in time that after every time I got off a session, because like I said, I do it online, that Cody would be like, "So, what'd you guys talk about me now, or what did you guys discuss about me now?" And I mean, he said it jokingly, but I know there's a piece of him that's like, But then eventually, it became like a point where I was like, you didn't come up at all." And then the next time you didn't come up at all. I was like,
it's not about you, bro.
Yeah, I have other fish to fry now. There's other things going on in my life. So anyways.
Yeah.
Perfect. So we had a little bit of a snafu where I deleted our ending. So we're doing this again real quick. If you all have access to EAP through your work, go check it out, ask questions, because it is a very helpful tool to get you started with therapy.
Yeah, I love that.
Yes. With that, Laura, I'll let you start the exit.
Yeah, so obviously this I feel like was such another great conversation. I feel like it's full of important information even that can help people, which is what we're here for.
Yes.
If you are looking for more support, you can always find us in our Facebook group, Bipolar Lines Pod. And it's a small group, but a pretty active group.
And growing, for sure.
Yes, you can also post anonymously in there if you're just reticent to, having your name out there or whatever. So come find us there. And then you can also find me on TikTok at the BP Spouse. And you can find you, Brooke.
Break_the stigma. Yes. And if you want to watch us do this, you can find us on YouTube, again, BipolarLines Pod. And episodes are released every other Wednesday on pretty much all podcast platforms.
Yeah, and if you appreciated this conversation, we'd appreciate it if you just rated our podcast. That's just an easy way to help us out for free.
Yep.
Yeah.
All right. Well, as always, thank you all so much for being here, for showing up for your person, and we'll see you next time.
See you next time.